Okay, ji. Assalamu alaikum. This is Dr. Sonia here. Again, continuing with the embryology. We have already discussed the embryonic period. We have discussed the fetal period and how the different tests are done to diagnose the different anomalies which can be there. Now, what can be the different types of congenital anatomical anomalies which can occur and what could be the causes and how we can prevent them. All this we are going to talk about now at the end of the general discussion in the embryo development. The congenital anatomic anomalies we are talking about, it is we have human birth defects, congenital anomalies, and it includes the congenital malformations. This is teratology. The congenital anomalies is teratology. Teratology means a branch of science that studies the causes, mechanisms, and patterns of abnormal development. So teratology believes in that what can be the cause which leads to this abnormality, what is the process which occurred, and what are the different types of abnormal developments which can occur. So all about the abnormality which occurred, why it occurred, what was the type, what was the process, and what all resulted. Now, teratology can be structural, it can be functional, it can be metabolic, behavioral, or hereditary. So it can take any form. It can be a structural problem, it can be a functional one, that is, the structure is normal, but the function is abnormal because there may be some abnormality in between. It could be a metabolic problem, it could be behavioral or hereditary one. So major structural anomalies occur in about 2 to 3% of the live-born infants. It is the structural anomaly. So you may have in about 2 to 3 of all the births which are there. Additional 2 to 3% in children by the age of 5 years. That means at birth, the anomaly does not appear, but when the child reaches by the age of 5 years, this anomaly becomes prominent because of the functioning, because of the modifications which occur. This this becomes obvious. So for a total of 4 to 6%, you can say some anomalies are which are very obvious at immediately you can see them at the time of birth, which give you them problem, and some which can occur by the age of 5 years that gradually you detect them. So which were not obvious at the time of the birth, but by the age of 5 years, these anomalies they become obvious as the body grows. So you can say about 4 to 6% of the total live births is the anomalies which are to occur. So birth defects are the leading cause of infant mortality because when the structure is not normal, so more chances of abnormalities to appear. So it is said that birth defects are the leading causes. That is the most important cause of infant mortality. About 21% of the infant deaths, they are because of these malformations. So even if it is a unexplained abortion after third month, that is because of this abnormalities, because nature's way of expelling out the abnormal structure which is there. So without any reason everything went fine with the mother, but the mother expelled out the baby there. It was abortion. This was because the baby was having either a structural abnormality or it was a genetic abnormality, any sort of abnormality. And to prevent this abnormality from going on, nature's way of expelling it out. So it's about 21% of the infant deaths are because of the, so that unexplained abortions, they are because of this fetal abnormalities. Causes of congenital anatomic anomalies or birth defects are often divided into different categories. There could be a genetic factor such as a chromosome abnormality would be there because of these chromosomes. It is about 15%, it is then because of the abnormal environmental factors, that is maybe the ultrasound rays, maybe the x-rays, maybe the other ultraviolet rays which were there, certain drugs which were there, certain infections which were there, that all affected the normal growth of the baby. So that can lead to congenital anomalies, and it's at about 10% is the cause which can of the anomalies is because of these environmental factors. Then it can be multifactorial. It can be both a genetic factor and it can both be a environmental factor. So it is a combination of both. A 20 to 25% can be a combination. So it can be the two basic reasons. One is the genetic factor, the other is your environmental factors, that is something which is from around, and 20 about 20% can be a combination of both these. So it could be partly genetic or partly it could be the multifactorial. So all those are there. Then twinning causes about, in problems in the twinning is said to be about 1% congenital anomalies in the twins are there. So it is about out of these percentages, it is about zero point 0.5 to 1% is in the twins which are there. It causes abnormalities. 50 to 60% of the congenital anomalies, the etiology is unknown. And then for about 40%, it is, we have labeled them as genetic factors, environmental factors, or multifactorial inheritance. And mostly the causes, they are not known. So 50 to 60% is said that the congenital anomalies, they are unknown. The cause of it is unknown. The anomalies may be single, maybe multiple, or of major or minor clinical significance. That is, one system may be involved, more than one system may be involved. They could be very minor anomaly, or the malformation that could just not affect the functioning or the life of the baby, or they could be a major one, that is, that needed surgery and that could affect the life of a baby. That is, it could be a minor abnormality which could be left. Supposing you have an extra finger in your hand or you have an extra finger in the foot, that doesn't give you any problem, so that is a minor one, so you leave it, you don't need surgical intervention. But if it is a major one, that is, supposing if you have your spina bifida with meningomyelocele, that is protrusion of the spinal cord as well as of the meninges, that is critical, because when the nerves, and you have the presentation as the nerve and paralysis, that is a major type of anomaly which needs clinical reconstruction. So it can be involving one system, that is single, or it can be multiple, or it can be, that can be leading to what we call as syndromes, or the anomaly can be a very small one or it can be a major one, as I've given you the examples, which needs whether surgical intervention, or if you leave this untreated, the anomaly, it will not affect your life, it doesn't threaten the life of the baby. Major developmental defects are much more common in the early embryos, that is, which results in 10 to 15%, and mostly, as I said, they abort spontaneously during the first 6 weeks. That is for an unknown cause. So it is said that they are major defects which were there, and it was nature's way of expelling the abnormalities. So, and chromosomal abnormalities are present in about 50 to 60% of the spontaneously aborted embryos. So that means the chromosomal abnormalities are at a high rate. They are about 60% in those which are ending up in, when, because of the mutation or the meiotic divisions, where there is the non-disjunction, and then that leads to abnormalities and that is expelled out. So it is about mostly the cause of abortion in the first few weeks, that is because of this chromosomal abnormalities, that is suspected that that is because of the abnormalities results because of the chromosomal defects. Now, if you see this chart, it shows you how much percentage, what can be the cause of the anomaly. It's unknown, as we have already said, it is 50 to 60% is unknown etiology. You do not know the cause of the anomaly. Then multifactorial is about mixed, that is genetic plus your environmental factors mixed, that is about 20 to 25%. Then the chromosomal aberrations are 6 to 7%. Mutant genes, that means again it is chromosomal in nature. Both these again, they are going to be 7 to 8%, and environmental, that is 7 to 10%. So you can say about 8 to 10% is roughly the chromosomal factor, then about 10% is your environmental factor, and the 20 to 25 is a mixed one, and unknown, but the rest of the 60%. So majority of these anomalies are unknown etiology because there may be no history, no exposure to the external teratogens, so it's labeled as unknown etiology. So according to this, very clear that majority are known as unknown etiology. Minor anomalies, they occur in approximately 15% of the babies. Major, we said, they are about 50 to 60%. Or you can say chromosomal out of the 10 to 15%, which were the major developmental effects. And out of this, there were the 50 to 60% were the chromosomal abnormalities. And minor anomalies are still another 15% of the newborns. So minor anomalies serve as a clue for diagnosing more serious underlying defects. That means if you have a small defect that is uh, something which is a problem which can be seen, or an anomaly or a malformation which is detected, this leads to the finding, or that you follow, you keep in mind that maybe there can be another anomaly along with it, or there can be a chain of events which can be there with more anomalies. So if you see one small anomaly, you say maybe there are many more, so you start looking for it. So that is a starting point. A minor anomaly is basically a starting point for diagnosing more serious underlying defects. That is exactly what it means. If you find something that this is not normal, then you say if this is there, it can be followed by many other malformations which are there, so you start detecting the other ones as well. Malformations occur during organogenesis, as we have said, and that time period is your embryogenesis, third to the eighth weeks of the gestation. Results in complete absence of a structure. Three things can occur. It can be a partial absence or alter it in the normal configuration. The structure is absent, it can be a partial absence, or it can be that there is change from the normal structure, which is that these three things can occur. And mostly they are during the organogenesis or the embryogenesis time period, that is till the eighth week, which is there, or the third month, you can say. And what can happen? Complete structure can be absent, it can be partial absence, or the alterations of its normal configuration, that is, the structure of the organ is partly modified. All these three levels of abnormalities can be there. The environmental or genetic factors acting independently or in concert, that is, can be purely one or the other or a mixture of the others. Disruptions, deformations, morphological alterations of already formed structure and are caused by destructive processes. That means something which had already, it can be that there could be a disruption, that is already formed structure that could be modified or disturbed or spoiled by any other external factor. By that is destructive process, that is a disruption. That is something which was there normally, but then it is disturbed. Then is deformations, that is result from mechanical forces that mold a part of the fetus over a prolonged period of time. The way you have it, club feet, for example, in compression of the amniotic cavity, when there is very small amount of fluid, or the amniotic cavity, the membranes are held together, the space for the baby to float is very little, and so the baby has to accommodate that small space, and in that it keeps the feet in the club feet, that is in a curved way. So that is deformation that results because of a prolonged period in a place, that is, the baby is staying in a place which is too tight for it to freely grow, and that leads to an anomaly. Structure is normal, but because of the place where the baby is placed is too tight for it to stay, and so the normal free floating development cannot occur, and that leads to a deformation. For example, it can be involved this musculoskeletal, and this can be reversed postlately, that is, by surgery you can correct it. Then a syndrome is a group of anomalies, that is, many anomalies occurring together that have a specific common cause. Risk of recurrence is unknown. That is not one anomaly, but many other systems may be involved. That is a syndrome. Association is a non-random appearance of two or more anomalies that occur together more frequently than by chance alone, but the cause has not been determined. Is a non-random. That is, they do not appear at randomly of two or more anomalies that occur together. That is in association, that is, it is seen that if this defect of the finger is there, then the defect of the finger of the lower limb is also there, or it is that certain other system is also involved. So that is an association, that if one problem is seen in one part, the other, it is a compulsion that another similar defect which is going to be associated along with it. So that is in association. That is this, that the two anomalies, they are always are going to occur together simultaneously. That is association. It is more frequently by chance alone, but the cause has not been determined, that why, if one defect is there, why should the other defect be occurring along with it. Syndrome is where many groups of problems can occur together. Deformation is due to the tight placement or the development, that deformed normal structure becomes deformed structure, that its placement becomes abnormal. Disruptions is already formed structure is defect become distorted, or by a destructive process. So all these things, these are the terms which can occur. So you can have complete absence, partial absence, or alterations of its normal configuration. This is what we call as alterations of its normal configuration, or that the structure is not there, it is the partially absence, or in its alteration can be there. So that can be a disruption, it can be a deformation, it can be a syndrome, that is many abnormalities together, or it can be associated. There are two problems or two abnormalities, they are always going to occur together. What is the cause? That is not exactly known. What are the environmental factors which lead to the abnormality? A teratogen is an agent that can produce the congenital anomaly or increase or the incidence of an anomaly in the population. That is what we label as teratogen. That is the causative. The causative agent is called the teratogen, which can lead to the abnormality. It can either cause the abnormality or it can increase the incidence of an abnormality in the population. Agents identified as teratogen factors that cause birth defects. There is not everything that is familial is genetic. Agents identified as teratogen factors cause the birth defects. That is, they are called the teratogens, they cause the abnormalities. Then there is something which is said that not everything that is familial is genetic. That means those abnormalities that you see in repeatedly in the families coming down by generations is a hereditary. It is not necessary that you see this, supposing one brother has it, one sister has it, the great grandparents had it. It's not necessary. It can just be a coincidence. It can be that this is not genetic. That means the cause is not genetic. That can be familial. That is, it is running in the families, but not because of the genetic reasons. That is, the cause is not genetic, but it's still, it is seen in more than one person in the family. That is, that not everything that is familial can have a cause which is a genetic cause. And teratogen is the causative agent that produces or increases the chances of abnormalities. Teratogens do not appear to be effective in causing anomalies until the cellular differentiation has begun. Again, that is the embryogenesis period, they become effective. That is, the teratogen may be there, but until and unless the differentiation starts, it will not be effective. That means it will not produce its harmful effects. Their early actions during the first 2 weeks may cause the death of the embryo, because it is so critical that in the first two, that is the growth age, that is going to the cause the death, and then it can later on, this can call the abnormalities which are there. So this is the illustration which you see at what time period, what part of the system is developing, and so the critical periods in human prenatal development, and so what can be affected at what time period. If you see in this, in the first two periods, that is not susceptible to teratogenesis. Death of the embryo and spontaneous abortion is common in this period due to the effects of this. That means where the implantation is occurring, where the disc formation is there, all this time period, though it is no differentiation is occurring, but still it is the time period when death of the embryo and spontaneous abortion is common. Then all these embryonic periods in which the different abnormalities can occur. Now you see that in the main embryonic period, and you see that is till the 8th week or till the 3rd month, most of the things are forming, that is differentiation, neural tube defects, mental retardation, heart defects, meromelia upper limb, meromelia lower limb, cleft lip, upper lip, so formation of the lip, so abnormalities of the lip, lower set and dense deafness, ear problems, eye problems. That is later on, because we've said after 3rd month in the fetal time period, ears and eyes, they reach their normal position. Then we had said that the teeth, then the palatal process, the genitalia, masculinization. So these are the different time periods with which the differentiation is occurring and at which certain abnormalities can be there. So major abnormalities, they are going to occur in first 3 months. That is this, and this the baby will survive. But these blue dots, they show you that what part can be affected in these time periods. And first 2 weeks is the time period when if there is some teratogen affecting the, though it is not very easy for it to be effective, but if the teratogen affects this time period in the first 2 weeks, it's going to result in spontaneous abortion. And then this is going to lead into the, so basically what exactly we are saying is that spontaneous abortion occurs in the first 2 weeks. So that is because of the effects of the teratogen, without any explanation, without any reason known, without any cause known. It's the end result is not the abnormality, but it's just a spontaneous abortion. And that is, shows you that without any reason known, abortion has occurred. That means there was some congenital anomaly due to which it is. So this picture shows you the different times of anomalies which are there. Principles of teratology. Factors determining the capacity of an agent to produce birth defects. These are the principles of defect, determining the capacity of an agent to produce birth defects. Susceptibility to teratogenesis depends on the genotype of the conceptus. That is, the determining the capacity of an agent to produce birth defects. Susceptibility to teratogenesis depends on the genotype of the conceptus, that is, male or female, whether the gene that is carried is by the maternal genome or whether it is by the paternal genome. Developmental stages at the time of exposure, that is, whether it is fetal time period or whether it is the birth defects is 3 to 8 weeks or it is the embryogenic time period. So all these, it's going to depend on whether the genotypic, what type of the conceptus is, and or what is, whether it is fetal time period or it is the embryogenic time period. So these are the two principles which are going to affect the abnormal development. Then the third factor can be on the dose and duration of the exposure. How concentrated or how much is the teratogen? What is, how high the dose of the teratogen? Then it can be dependent on the mechanism to initiate the abnormal embryogenesis. That is, at what level it has affected and how can it can make the development abnormal. Then death, malformation, growth retardation, functional disorders, manifestations of the abnormal development. That means all this can be because of the reason, that is, these are the principal. Death can occur, malformation, growth retardation can be the result of these teratogens. Functional disorders can occur. It can be a structural disorder, it can be a malformation, it can be a growth retardation on maybe the death. Defects may also be induced before or after this period. That is, no stage of development is completely safe. So these are the principles. That means it is going to factors determining the capacity of an agent to produce birth defects. That is genotypic appearance, time period at which the teratogen is acting, how much dose is the baby is exposed to, mechanism to initiate the embryogenesis, how much effective that is, death, malformations, all these factors may be induced before or after this time period. So no stage of development is completely safe. Then, when considering the possible teratogenesis of an agent such as drug or a chemical, three important principles must be considered: that whether a certain chemical or a certain thing is teratogen or it has a normal effect. The critical periods of development, it can just be judged at that time period, at when they are the critical period, that is at the embryogenesis. Then the dose of the drug, maybe a very small dose cannot be harmful, but if in a large dose it is given, it acts as a teratogen. Then the genotypic, that is the genetic constitution of the embryo. All these three factors will depend on, these will depend whether a thing, whether a drug, chemical exposure is becoming a teratogen, or it can be a teratogen, or it will just not affect the it will lead to just the normal development. So all these three factors will on this you can base whether it is a teratogen or it is not. Maybe in small doses it does not act, maybe in humans it acts as a teratogen but not in the animal. So all these factors, they have to be taken into consideration whether it plays a teratogenic effect or not. So all these things, they have to be taken into consideration before labeling anything as a teratogen. Then, what are the critical periods of human development which can be effective? The stage of development of an embryo when an agent such as drug or virus is present determines its susceptibility to a teratogen. The most critical period is when cell division, cell differentiation, and morphogenesis at its peak, as we have already said. Critical period for brain development is 3rd to 6th week. Differentiating and growing rapidly at birth continues throughout the first 2 years. So brain development is starting from 3rd to 15 weeks birth, and then after 2 weeks. So that means brain development can be affected at any time period. Mental retardation, embryonic and fetal periods can occur. Tooth development continues after birth, that is 16 years, and that is milk teeth, permanent teeth. So it can be, that can be affected. Skeletal system, prolonged critical period into childhood. So brain development has a long critical time period that can be affected. The tooth development, the skeletal system, it all there, and majority of the organs of the body, they have a critical time period, and that is the cell division, cell differentiation, and morphogenesis. So because your brain continues to grow on even after birth, so this is all, that is why it is said that up till the first 2 years when the brain is developing, that is a critical time period. Anything even after birth can be effective in producing as a teratogen. Tooth development erupts at 6 months, goes on, then there is milk teeth production, then there is the permanent teeth. So that is a long critical time period. Skeletal system, as the growth of the bones go on, then the critical, it has a critical time period. Anything when the growth is occurring, your epiphyseal cartilage is growing on. If any disease, any factor, or any surgery or any accident affects that epiphyseal cartilage, that is going to affect the growth, or it can form a malformed bone. Environmental disturbances during the first 2 weeks after fertilization, extraembryonic structures form, no anomalies, only early death and spontaneous abortion, that is first 2 weeks. Physiological defects and functional disturbances, disruption during fetal period, that is if affects at fetal period, it's going to be a physiological problem. If it affects before that first 2 weeks, it's going to be a spontaneous abortion, and it is between second to the eighth week, it's going to be a congenital anomaly. The genotype of an embryo determines whether a teratogenic agent will disrupt its development. That is what type of the genetic formation is. So that depends on what type of embryological problem can occur. Dose of the drug different in humans and animals. As I've already said, the drugs to be considered a human teratogen, a dose response relationship has to be observed. That is, greater the exposure, the small dose, greater the exposure, it can be a teratogen. A large dose, longer period, or for exposure for a very small period, that can have different effects. So it will depend on how much dose is there, how much that dose, small or large, is going to have an exposure to the body. So whether it will produce a teratogen. Some drugs are so critical that a small amount quantity of the drug can be teratogen, even exposed just a very for a small 1 minute or even a very few seconds, it can be a teratogen. Or something is the small dose or a large dose, even for a longer period exposure for a longer period, will have no effect. So these are all the factors that is that they are seen. So many factors which affect or they become a teratogen. Human teratogens. Some cause severe disruption of development administered during the autogenic period. Others cause mental and growth restriction and other anomalies if used excessively throughout the development. So it can be both ways, either just through the embryogenesis, they cause severe disruption, or if it is used, something which is used throughout the growth, it can cause the mental or growth restriction. 40% to 90% of the pregnant women consume at least one drug during pregnancy. Several studies have shown that an average for four drugs, excluding nutritional supplements, approximately half of these women take during their first trimesters. There, an average of four drugs, that is maybe for nausea, maybe for some headache or some other reason, these are minimum of four drugs has been listed that the mother pregnant female takes it, other than the nutritional supplements. Approximately half of these women take them during the first trimester due to one reason or the other. Drug consumption can also, that can be teratogen or it can be a non-teratogen. So drug consumption also tends to be higher during the critical period of development, and heavy smokers and drinkers, all that is going to cause congenital anomalies. Despite this, that means that is a normal procedure that is occurring, that is, women take about 3 to 4 drugs average in the first trimester due to one or the other reason other than the supplements, or they are smokers and drinkers. All this leads to, despite all this, they are going to be less than 2% of the congenital anomalies are caused by drugs and chemicals. Only a few drugs have been possible. So it's not necessary that anything which is taken during pregnancy, during the first trimester or the second trimester, is a teratogen. So it can be less than 2% of the congenital anomalies, which can be because of these things taken by the mother. Only a few drugs have been positively implicated as human teratogen. And so it's not necessary whatever is taken during pregnancy is going to act as a teratogen. So that is exactly what it means, that there can be less than 2% chances that it can cause congenital anomalies. Only 7 to 10% anomalies are caused by recognizable teratogens. New agents continue to be identified. It is best for women, so that is why all this reason, how much exposure is there, what is the concentration of the drug, what time period the drug is taken, it is best for women to, that the general principle, it is best for women to avoid using all medication during the first trimester unless there is a strong medical reason for its use. That means you cannot do without that drug, you have to take it. Only then, and then only if it is recognized as a reasonably safe. That means that you are having hyperemesis, a lot of nausea and vomiting. You have no choice. You try to restrict yourself to prevent it or control it, but still it is uncontrollable and you need to take some medication. So you try to take that medication which is well known for minimum effects or congenital effects causing teratogenic effects. So it is a general principle that a woman to avoid using all medications during the first trimester, that is roughly up till the 8th week. And if worse come worse, you need a medication, you go for a medicine which is have known for, which has been under by research has been known that this drug has minimal congenital anatomical effect, or it is having the minimal teratogenic effect. So that is the, all these reasons that I have already listed give you this basic principle that has been taken into consideration. So worst come worst, you go for a drug, otherwise try to avoid any exposure, any medication or anything. Drugs as teratogens. What are the different drugs which can act as teratogens, which have been known, which have been researched and seen that they are causing problems? Drugs as teratogens. Drugs vary considerably in their teratogenicity. Again, cigarette smoking, it's going to result in small babies, that is intrauterine growth retardation. The caffeine that is in coffee, tea, drinks, that is chocolates, is not known to be a human teratogen, though it is widely used. Alcohol is said to be 1 to 2% of the babies are affected. Maternal alcohol abuse is thought to be the most common cause of mental deficiency. Now, it is said that it causes problems in 1 to 2%, but now it is known, well known, that mental deficiency is because of intake of the alcohol. The safest advice is total abstinence from alcohol during pregnancy. So these can all be. Cigarette smoking causes small babies. Caffeine is consumed, but it is not known to be a teratogen. Alcohol, 1 to 2% of childbearing age, but still now it is known that mental deficiency is because of plenty of alcohol intake. So it is best to avoid alcohol intake, that is during pregnancy. Androgen and progesterones, these hormones properties, they have masculinizing, that is they cause hirsutism, hair growth, male genitalia in females. Those if the females are taking all these androgenic drugs, so they affect the female fetus and they produce masculinization of external genitalia. So if a mother is taking, due to some reason, these hormones, androgens and progesterones, they can cause, if it is a female baby, they can produce masculinization of the female baby that the mother is carrying. So this is, testosterone will also produce such effects. So it is better to avoid these hormones. Contraceptives are also hormones, so they should be uh, not known still whether they are teratogenic, but still they should be avoided because they are hormones. The diacetyl is also a human teratogen, because certain researchers have done that, they have found that these are abnormal effects. Antibiotics, teratogens, tetracycline is well known for mottled teeth, that is, it stains the teeth. Deafness, streptomycin is well known for uh, causing deafness. Anticoagulants, hemorrhage in the embryo of the fetus, that is warfarin. Anticonvulsants, epileptic disease drugs, that is valproic acid, phenytoin, these cause the neural tube defect. So all these medicines, so that is basically generally what we say is any sort of medicine has to be avoided. If there is a condition which cannot be avoided, then only the safest medicine known has to be taken. So you can see any drug can have effects of, some may be well known effects, some may be not well known, but they can cause a problem if it is taken. You see all this, these are the congenital malformations because of certain drugs. Anti-neoplastic, anti-cancer drugs, they are said to be teratogenic because they are going to affect the mitosis, they are going to cell division. Anti-nausea, thalidomide, that is the limb problems has been seen, that is very common drug, that is amelia, absence of limbs developed because of this drug thalidomide. Corticosteroids should not be taken first weeks. Vitamin A is known as a teratogen. Aspirin potentially harmful for the embryo. So all these drugs, they are a teratogen. That means they can cause one or other abnormalities which are there. This is amelia because of the nausea. The very common drug was thalidomide, and that thalidomide ultimately it was seen that caused limb problems, and this is the case of a limb problem. Insulin and hypoglycemic drugs is not a teratogen in human embryos. Women with insulin dependent diabetes may significantly decrease their risk of having infants with birth defects by achieving good control of the disease. That means by diet, and their diabetes should be well controlled before they start conception, and that is why, so that the level is so low that they need to have minimum of intake of insulin, otherwise that can also affect the pancreas of the baby. Approximately 4% of the pregnant women have diabetes. That means that is called diabetes during pregnancy. Not pregnant, not diabetic initially, but during pregnancy, they, because they have a tendency, they can become diabetic. Poorly controlled diabetes mellitus in the mother, particularly during embryogenesis, is associated with increased rate of spontaneous miscarriages and 2 or 3 fold higher incidence of birth defects. So minimal amount of insulin has to be taken in because it is something which is coming from outside. So care has to be taken. Thyroid drugs, tranquilizers, psychotropic drugs not advised, street drugs, that is environmental chemicals, etc., which in which you have mercury, lead, infectious agents, certain diseases, rubella, simplex, chickenpox, congenital syphilis, maternal infections, all these can lead to congenital anomalies. You can see all these: congenital cataract, radiations as teratogen, exposure to high levels, so ultrasonic waves, electromagnetic fields, mechanical factors as teratogens. Amniotic fluid absorbs mechanical pressures, amniotic bands. That is, if there is less amount of amniotic fluid, then the position of the baby would be just a very curled one. And that, because of that, again, the baby normal structure will not have space to grow, will not have baby to float. So this can lead to all sorts of abnormalities. So the baby has to occupy that small space, and it leaves in a curled space, and this is what we call as amniotic bands. That is, it does not allow the limbs to grow or the structures to develop. That is what is called as the amniotic bands because of these pressures. This can also affect if these points are there. If you can see at certain sites, they are restricting that area from growth, and that leads to the abnormality. That is called the amniotic bands. We'll talk about it. Anomalies caused by genetic factors, that these were all structures which were teratogens one way or the other. Now we come to the anomalies which are caused by the genetic factors: a chromosomal disorder, anomaly, aberration, or mutation. Chromosomal abnormality disorder, this is a mutation is missing. All this is missing extra or irregular portion of the chromosome. That means the whole of the chromosome is missing. There is one extra or small part of the chromosome is missing. So all this can occur. Chromosome mutation, a change in the chromosomal segment involving one more than gene. The term karyotype is for an individual can be compared for the normal karyotype specified by the genetic testing. That is, you take the pattern of the these chromosomes and of the see all the structures, whether all the limbs of the chromosomes are normal, and if one is missing or if one part of the chromosome is absent, that is what we say genetic testing. And this is the term karyotyping. Is then we see that this number of chromosome is present or this is missing. That is all what we say as karyotyping. Chromosome anomalies usually occur when there is an error in cell division following mitosis or meiosis. So The common time period is when mitotic or meiotic division is occurring. Anomalies can be numerical or structural. So when you study the chromosomes, that study is what we call as karyotyping. And this normal karyotyping for the species via the genetic testing. So that is seen. Chromosomal abnormalities, important cause of birth defects and spontaneous abortions. 50% ends in spontaneous abortion and 50% has chromosomal abnormality. So it is both ways. The most common abnormality in abortus is 45X, that is monotriploidy, and trisomy, that is 16 chromosome is affected, and that is one there is less chromosome. Chromosomal abnormalities, they account for 7% of the major birth defects and gene mutations and additional defects. So that means chromosomal abnormalities are about 7%, and gene mutation, that is just the chromosome number is the same, but there is some malformation in the gene, or the mutation or the normal structure of the gene changes. That is what we call as gene mutation. That is about 8%. Inheritance, what is the role of inheritance in genetic problems? Most chromosomal abnormalities occur as an accident in the egg cell or sperm, and therefore the anomaly is present. It can be, but some cells have the anomaly and some do not. So whenever anomaly is present in every cell of the body, therefore the anomaly is present. When there is an accident, that there modifications occur in the cell of the sperm and the ovum. Anomaly is present in every cell. Some anomalies, however, can happen after conception, resulting in mosaicism. That is, when some cells have the anomaly, and some, when it is first is initially the egg cell and the sperm, they had the problem that is there. That is the changes, they were there. So that means when they cross over, they are going to transfer that abnormality to each other cell. All the cells are going to have that. But once, if it is after conception, after fertilization, so that means one cell had the problem and the other did not. So when it is going to transfer the anomaly through some cells, that means some cells will have normal structure, and some cells will have the transmission of, from the parents, the transmission of the anomaly. So where some cells have the anomaly and some do not. So that is after conception. But if the problem or the genetic problem was there initially in both the cells, mother egg and the sperm, it's going to transfer to all the babies. But if it is just occurring after conception, so that means one parent has it, so it's going to be present in some and absent in the other. Chromosomal anomalies can be inherited from a parent or be de novo. That means it's not necessary that they are inherited, they can appear all of a sudden. Chromosomal studies performed on parents when anomaly in children, in a child, if parents do not possess the abnormality, it was not inherited. That means if the parents don't have it, it's not labeled as an inherited problem. May be transmitted due to subsequent generations. That means it was transmitted later on. That means if the parents don't have that problem, it's not labeled as inheritance. It may be transmitted due to subsequent generations from left and right, or due to some modifications. Acquired chromosomal abnormalities. Most cancers could cause chromosomal abnormalities, that is, due to some changes with either the formation of a hybrid gene. Consistent chromosomal abnormalities can turn the normal cells into a leukemic cell, such as the translocation of the gene, that is, when there is modification in the gene, then there can be leading to the normal cell into a like abnormal cell. Damage in the spermatogenesis. During gametogenesis, DNA repair, removing all this, the spermatids during major nuclear chromatid remodeling, all this abnormality can result. Non-disjunction. Changes 50% of the chromosomes shifting onto each side. If this does not occur, then there is abnormal number of chromosomes. That is the failure of the homologous chromosome sister chromosomes to separate properly. That is, most embryos cannot survive with the mixing or the extra autosome. So if it's not 46 one place, one side you have 45, or one side you have 46, that can lead to this abnormality. That is because of the non-disjunction, most common cause of the chromosomal abnormalities. There are three forms of non-disjunction types. Failure of a pair of homologous chromosome to separate in meiosis 1, to separate during meiotic division 2, or during mitosis. So at any step, this separation can occur, failure can occur, and that leads to the abnormality. Non-disjunction results in daughter cells with abnormal chromosome numbers, and that is what we call as aneuploidy. So If the equal number of cells do not divide during mitosis or meiosis, it can result into an anomaly. Non-disjunction occurs during mitosis, that is mitotic non-disjunction. Some conditions produce mosaicism, with some cells having an abnormal chromosome number and others being normal. So it can be a mixture. Mosaicism is some cells have an abnormal chromosome number and the other have a normal number. So it is a mixture. That is what is called a mosaic appearance. It has a mixture type. All sorts of pictures can be seen and you mix them up and you have a collage of different types of cells. Chromosomes break, pieces of one chromosome attached to their other, that is called as translocation. No critical genetic material. It may not produce any congenital anomaly if no critical genetic material is lost or transferred. That case, the individual would be normal. If a small piece of one chromosomal part is shifted onto the other, but it does not affect a very critical genetic material, that is, the baby is going to be normal. If it is an unbalanced one, that is, if the part of the chromosome is lost, an altered phenotype is produced. There can be numerical abnormalities. The number can be changed. It can be 46, it can be 20, then 23, and if it is non-somatic or diploid, 2n, so it can be euploid or aneuploid. Exact multiple can be there. When extra chromosome is present, it is a trisomy, and when one is missing, it is a monosomy. So abnormalities in chromosome number may originate during meiotic or mitotic divisions, again because of non-disjunction, or autosomes or sex ones. Chromosomes. The incidence of chromosomal abnormalities, including non-disjunction, is increasing with age because we said more exposure to the female ovum because of the long time of the cycle which is there. So it can occur, this non-disjunction, numerical one, that is not equal distribution, can occur due to any stage. Aneuploidy originates during cell division when non-disjunction occurs. Presence of abnormal number of chromosomes, 45 or 47 can be there. A cell with number of complete set is called euploid, and an extra or missing chromosome is the common cause of that genetic disorder. So that means again non-disjunction. Some cancer cells also have abnormal number of chromosomes. About 68% of these tumors are aneuploid. So most cases are going to result in miscarriage, and the most common extra autosomal chromosomes among live births are these chromosomes, which are number 21, number 18, and number 13. They are going to show you the autosomal abnormalities. Changes in chromosome number necessarily be present in all cells in an individual. It can be, some can be normal, some can be abnormal, and so that is what we say as mosaicism. If you see this, this is translocation. Small parts of the chromosome material has been exchanged, and in this cell you can see in the second meiotic, in the first, you can see that one cell, the cell is abnormal, no chromosomal abnormality is there, or the chromosome is there. Then in the second non-disjunct, second meiotic division, one cell of each is having abnormal chromosome, that is a translocated genetic material, and the other they are without any. So it is 45 or 47 number of chromosomes which are going to be there. Again, this shows you all that can be a non-disjunction where you have these arrows. It can be at any level producing an abnormality. Two kinds of changes occur in the chromosomal complement, numerical or structural. After the sex chromosome or autosome chromosomes, the phenotypic may look like other persons with the same chromosomes. That is, there are certain faces which are said to appear. If you see a Down syndrome child with the broad nose, slit-like eyes, all these features, they are typical for a Down syndrome baby. So that is why they say that a baby who has a chromosomal defect is going to resemble another baby who has a similar chromosomal defect. So that is, they say that the phenotype, that is the external appearance, the characteristics will look more like a person with the same chromosomal abnormality, and then their own siblings, that their own, rather than their own sisters and brothers, they're going to resemble more of the having those chromosomal abnormalities, they will resemble those children. So changes can be numerical and structural. Numerical disorders can be more or less, that is 21 or 23. So more than that, Turner syndrome, tetrasomy, all these can cause, and these are most common in advanced maternal age. Sperm aneuploidy can be there, increased because of tobacco smoking, insecticides, all these that can lead abnormal sperm. It can be associated with increased DNA damage in the spermatozoa. These are the numerical abnormalities. You can see individual is missing in one of the pairs, trisomy, individual 3 chromosomes instead of 2. Again, you see that there are changes. The number is changed. The 2 chromosomes, they are not in the similar structure. They have a modification in the structure. If you see that, you see this is 3 instead of 2. This is having monosomy, that is 1 chromosome. The others are all normal in appearance. That is the numerical type of abnormality. Consequences are a result of this error, that is non-disjunction with imbalance of chromosome, that's held to be aneuploid. Loss of single chromosome -1 is called as monosomy, and gaining a single chromosome is referred to as the trisomy. So aneuploidic gamete is fertilized, a number of syndromes might result. That means if one of this type of chromosome is going to fertilize a normal female, again the number of chromosome is going to be different, and so you have many sorts of syndromes which would result. Monosomy commonest is Turner syndrome, female appearance, all these features which are there, triple X syndrome. You see this Turner syndrome is monosomy, the commonest which is there. Autosomal trisomy can be there. That means in the autosomes, that was sex trisomy. Monosomy, this is the chromosomes other than the sex chromosomes, that is the autosomes show you the trisomy, that is 3 copies instead of the normal 2 ones. It can also be in the autosome. It's not necessary that sex chromosomes show you these changes. Down syndrome, 21 number of chromosomes which is there, which is affected. This is Down syndrome. Most babies resemble, and this is the Simeon crease, that is there. The flat nose, oblique palpebral fissure, protruding tongue. Children with Down syndrome, they resemble each other. See all these are the different faces which resemble each other. This is the typical face. Edwards syndrome, trisomy 18 and 13 chromosome, they are affected. See this, all these features. Sex chromosome aneuploidy, the term sex chromosome conditions with an abnormal number of sex chromosome, that is 0, other than XX and or XY, that is conditions with an abnormal number of sex chromosomes, normal XX or XY. Klinefelter's, that is more than 1. So 47 instead of 46. Klinefelter's is the commonest XXY trisomy. These are the features of Klinefelter's. Trisomy X is a form of sex chromosome aneuploidy where females have 3 instead of 2 X chromosomes. Excess incidence of XY by 2 Y syndromes. 2 Y chromosomes can be there. Monosomy is the Turner syndrome. See these. Diagnosis is best achieved by chromosomal analysis, that is DNA analysis, tetrasomy, pentosomy, all these tests they're done, that is karyotyping is done. Extra chromosome does not accentuate sexual characteristics. Usually the greater number of sex chromosomes present, the greater the severity of mental retardation and so all sorts of presentations can be there. Then you can have, this was number, this is structural abnormalities can be there. Chromosome number, it can be deleted, a portion of the chromosome is missing. Duplication, the material of chromosome is duplicated. Translocated, that is one chromosome portion is transferred onto another chromosome. It can be segments of 2 different chromosomes have been exchanged, or entire chromosome has shifted onto another one. So all sorts of structural abnormalities can be there. There can be inversions. A portion of the chromosome that has broken off turns upside. One part of the chromosome breaks up, that goes on and attaches to the other chromosome, and but not in the same way, but in the inverted way, that is inversion. Insertion is a portion of one chromosome has been deleted from its normal place and inserted into another chromosome. All these are structural problems. Rings, they can be broken off from one and attached in a ring form in the other. Isochromosome mirror, formed by the mirror image copy of a chromosome. Chromosome instability, chromosomes, all these, if you see these are the different types of abnormalities that can be there. It can be a deletion, it can be a duplication, it can be an inversion. So any types of abnormalities can result, structural abnormalities. This is the ring type duplication. Structure usually result from chromosome breakage. Breakage is caused by drugs, radiation, or viruses. Microdeletion characteristics that are differentially expressed depending genetically and inherited from the mother or from the father are genomic imprinting. Paternal chromosomes, so it can be either the mother or from the father. You see these abnormalities. Karyotyping involves performing an amniocentesis in order to study the cells of the unborn fetus during metaphase 1. Light microscopy can be used to visualize to determine the aneuploidy. Diagnostic technique for identifying the genetic abnormalities is cytogenic analysis is used to assess chromosome number and its integrity, establishing cell cultures that are arrested in metaphase by chemical treatment, and then light and dark bands are seen, and then they are seen whether the chromosome is normal or not. Anomalies caused by multifactorial inheritance, a combination of genetic and environmental factors can be there. Multifactorial traits are often single. Major anomalies such as, that is, they appear as one problem, but they are major problems. All these are the different causes: cleft lip, cleft palate, neural tube defects. All these are multifactorial traits. Risk, recurrence risk used for genetic counseling of families that have birth defects. It is important that the families are told that this family problem are going to appear. So the parents have to take very care not to repeat this problem again and again. Recurrence risk used for genetic counseling of the families having birth defects determined by multifactorial inheritance. So this leads to the counseling. If these abnormalities are there, the family has to be told, they have to be careful because this was there in the initial baby, it can reoccur. So they should be very careful. Risks based on frequency of the anomaly depend on that. Gene mutation can occur as a permanent alteration in the DNA sequence that makes up a gene such that the sequence differs from what is found in most people. Gene mutation can be classified in two ways: hereditary mutation, inherited from parents and present throughout a person's life, virtually every cell in the body, called the germline mutation, present in the parent's eggs or the sperms. This is a hereditary one. Fertilized egg receives DNA from both parents. If has a mutation, the child grows from the fertilized egg will have the mutation in each or his or her cells. Acquired mutation, present only in certain cells, occurs at some time during life. This is not in every cell in the body, caused by the environmental factors. Can be the acquired mutations in somatic cells, cannot be passed to next generations. These are the sex cells, they pass because they are going to pass to the baby. So if it is mutation in the sex cell, it is going to pass on, and every generation is going to have it. But if it is an autosomal one, it will not be acquired ones, they will not pass on. It's just the genetic ones which are going to pass through. If as a mutation, fertilized egg cell receives DNA from both parents, it has a mutation. The child that grows from the fertilized egg will have a mutation in each of his or her cell, whereas the acquired one will not be present in all, and it will not necessary to pass in all the cells. Polymorphism, most disease causing gene mutations are uncommon in general population. Gene alterations that occur in more than 1% of the populations are called polymorphism, enough to be considered a normal variation. No negative effects on the person's health. Some may influence the risk of developing certain disorders. Detection, different tests which are done, different techniques for prenatal diagnosis, amniocentesis, CVS, circulating fetal cells, all these pre-implantation diagnosis, a blastocyst biopsy can be done, bone marrow biopsy can be done, and all these tests are done to check these chromosomal. So chromosomal abnormalities can be two. One is the numerical and the other can be the structural. It can be one more or one less. Structural can be a deletion, duplication, ring-like, so that a whole of the chromosome might modify, or it is a part of the chromosome from one can change to the other. Then there can be a gene mutation, that is, if it is by inheritance, all the cells are going to carry that mutation gene. If it is acquired somewhere later on, it's not necessary that each cell will carry it. So this is all about the birth defects. I told you what are the different teratogens, what are the principles which can follow. Every teratogen, it's not necessary that it can be a teratogen in every person, but it may be a teratogen in some, or in not in the others. It may be a teratogen in the humans, or it may be a teratogen in the animals. It depends on the concentration. If the concentration is some structure can be small amount, exposure for a small time can be very drastic, or it can be a small amount, long exposure needs to be a teratogen. So all these are the different principles which can occur. So that was about the genetic fetal abnormalities which can occur, mostly the genetic one and then the multifactorial one. Okay then, thank you.